Today, we're going to talk about what are the minimum requirements for quality system procedures for an initial importer of medical devices in the US. So, if you're in the US and you're importing product from another medical device manufacturer outside the US, this is the video for you. So, it tells you what your quality system requirements are. If you're outside the US, this is what you are telling or making sure, verifying your initial importer, who is a supplier of yours, they're providing a service, is doing in the US. So you want to make sure they do this. You want to make sure this is in your agreement with them, supplier quality agreement or distribution agreement, whatever title you want to give that document. These are the things that should be in there. Now, if you are a US manufacturer and you're not importing anything, put comments below as to what you want next time. So, number one absolute minimum requirement is that you are registered with the FDA as the initial importer. So that's a requirement. Yes, you have to pay the $7,653. No, there is not any small business discount for you. That's only for 510K submissions or de novos, the user fee for a submission. For registration, there are no discounts. So $7,653 for fiscal year 2024. There's not even any prorating of it. So you pay now, it's only good until September 30th. You still pay that same amount. So that's number one requirement. You have to be registered with the FDA, and you have to identify in the registration what companies you are importing from. There could be more than one. So that's number one requirement. In terms of procedures, you have to have a procedure for distribution. So you're going to get products in from your supplier overseas, and then you're going to distribute it to your customers. Now, those customers could be other distributors, or they could be an end user. It could be Amazon. Wherever you're shipping them, you need to keep records of how much you shipped, what lots you shipped, what dates you shipped them. So how many, where you shipped them, and what lots. That's what you have to have. You can do that electronically. It's recommended you do that electronically. The reason why is if there is a recall, you need to be able to give a list of that information to the company that's recalling it so they can issue letters. And they may ask for your help for things like distributing those letters because it takes a long time to ship things from overseas. If you can do a mail merge print and send it off to the post office, that might get them a couple of days off, and that might help. You might make phone calls to avoid even having to do the letters. But whatever you're doing to help them with the recalls, that can't even begin until you can tell them where it shipped and who it was shipped to, and make sure that you've only identified the lots that need to be recalled instead of everything has to be recalled. So that's number one requirement for procedures. You have to have a distribution procedure and records of the distribution and electronic records that you can create a report of real quickly. That's what you want. I often get pushback saying, but we don't want to give that information to the manufacturer. If it's a recall, you don't have a choice. If it's not a recall, you can redact things. And you should have a legal contract that says that they can't steal those customers from you. Okay, so that's number one, distribution. Number two, complaint handling. This one is a little bit of a gray area because you may be the complaint file establishment, you might not. Your name might be on the label, it might not. So if your customers that buy it from you and you distribute it to them are contacting you and telling you there's a problem with it, you either have to record it as a complaint or you have to communicate that information immediately to the manufacturer so they can record it as a complaint. If you're the one recording the complaint, then you're the complaint file establishment. If you're just passing along the information, you're not. That doesn't mean that you are the investigator. Investigator could be anybody. It could be outside the company. It could be neither company. It could be a third-party lab. So the investigation of the complaint is not the same as the company that has the record of the complaint. But it is not uncommon to have importers or a complaint file establishment and the manufacturers a complaint file establishment because they're doing it for different markets or they have redundant systems. So you have to have that agreement. Who's going to do that? In general, it's a really good idea to have these records because when the FDA asks, you want to be able to provide them. If you say we're not the complaint file establishment, you just hand that information off to the manufacturer, then you need an agreement that says that. and you need to show that you've been doing that. Um, in general, I think it's easier just to record the information so you have the record, and then everything after that is taken care of by the manufacturer. So they do the investigations, and you close the loop to make sure they've done that, because you want to make sure they did the right thing by your customer and communicate any conclusions from that investigation to your customers. You also kind of want to make sure that corrective actions are being taken by the manufacturer. The next thing is reporting. Most people are like, well, I'm not the manufacturer. Why do I have to do medical device reporting? If somebody gets seriously injured or died, you have to do the reporting. It's not an optional thing. You have to do it, which is usually the reason why you're also a complaint file establishment. Now, for reporting, it also applies if it could have caused a serious injury or death if it were to occur again. A lot of people aren't aware of that nuance of the language. So, whoops, we had a near miss. That's still reportable. But in these situations, um, if the um, if the complaint investigation is done and you determine that it's not reportable, it still should be something you communicate back to the manufacturer. So you're still required to report to the manufacturer so they can take appropriate corrective actions. And depending on how things are done, whether a corrective action is implemented or not, that might trigger reporting because the corrective action was taken. So, and they might also have reporting requirements in other countries, if not in the US. So, depending on the situation, what the outcome of that investigation is, there could still be reporting requirements in their country, in some other country, in the US. So, in general, I would want to see a distribution procedure. I'd want to see a complaint handling procedure. I'd want to see a reporting procedure. That includes the ESG gateway. So, you probably want a work instruction on how to create up a web trader account and how to create that. And they're going to have a new system out this year. So if you're not familiar with that, there's the next gen ESG that the FDA is setting up. That's going to be released sometime around July to September. Somewhere in that time frame is when they're estimating the release. They've been advertising this for about 6 months or so. So that's going to be a brand new system, and there will be multiple releases of it as they roll out beta versions. I think it'll be a substantial improvement in a better system for us, but it's new to everybody. So you're going to need a new procedure for reporting. You're going to need a new work instruction for that new system. Those are the procedures you're going to need. Do you need a recall procedure? Maybe yes, maybe no. You're required to assist. So, would it be a good idea to have a work instruction that tells you how to generate that report? Yeah, it probably would be. It might be part of your distribution. It might be, if there is a recall, this is how you generate a report of the distribution. And it could be embedded in your distribution procedure because you're not the one conducting the recall, you're just helping. And you providing the distribution records is that. So, how you define the different roles and how that's going to be captured in a procedure, you could combine certain things into one procedure and to not have multiple, but you have to be aware of what your responsibilities are. You might, I see some initial importers, they actually assemble things, they install things, they provide service to customers. So, if any of those things apply to you, yep, you're going to need a procedure for those. So, especially installation, you have to have records, procedures, training, and you also have to have records that you validated that it was installed correctly. Software validations and actual hardware validation. Make sure it works after you've installed it. Almost like an IQ if you're familiar with installation qualification for production processes. If in addition to the installation, you have service. So if you have any non-disposable devices are going to be reused. Eventually, they wear out, they break, they need a new battery, they need calibration, they need software updates. Those are service items. Things don't last forever, and we don't warranty them forever. So they need service. You have procedures for service, records of service, and you have to verify and validate that it was serviced correctly. You might also have as a service, oh, this might be a complaint because this didn't fail when it should have or failed in a way it shouldn't have. So you report that back. We think this is a complaint because it's a malfunction we discovered during service. And then you also have, so I said installation, service, and then you could also have um, companies going out there and asking you for training. There are a lot of things as a company that you're going to provide as a service to your customers. You should have procedures for those. Um, if you have a disposable product and you have a supplier quality agreement that says your manufacturer is responsible for the complaints, and you don't ever have any reports, um, you still need those distribution agreements, and you need that agreement that says what they're responsible for and what you're not responsible for. And you still need to be registered. Now, if you are watching this webinar, you're probably somebody that cares a little bit about quality and regulatory. So I don't know why you're asking what the minimum is. You really want to be asking what would be best practices. That would be a much better question. So, what would be best practices? You might consider getting ISO 9001 certified and providing the best possible service to your customers. You might be asking for customer satisfaction and customer surveys that go out and give that information to your manufacturer. Look for better suppliers if somebody's not happy with the product that you're giving them now. Suggest improvements to the product to the manufacturer of the product. Maybe offer additional training. That's another concept. So there's a lot of things that you can do that would be better. You can provide document control, record control. There are training for your sales force, technical support. There's all kinds of things that you could do better if you have a quality system in place and you're embracing what would be best practices. But I've described what the minimum requirements, which is where a lot of people want to go to save money. But if you're a medical device manufacturer, impressing your company with the quality of your service and the quality of your customer service can go a whole lot further to generating sales than doing the minimum. So, in summary, distribution agreement, distribution records, distribution procedure, complaint handling, probably complaint handling procedure and records, reporting, so you can report any adverse events, injuries, deaths, or report it back to the manufacturer if it's not reportable. And also, how are you going to support if there's a recall? Some instruction either in the distribution procedure or a separate procedure, a work instruction on how to generate that list of distribution. And your manufacturer might even challenge you with a mock FDA recall. So if we were to recall this lot, what would you do? Please show us. And you can always redact some of the address information so they can't contact your customers, but show that you can generate that. That's what I would expect. And you want to expect the same thing if you are in Europe or in Asia and you're importing the product to the US or exporting the product to the US and you're looking for an initial importer. These are the kinds of things you want them to be able to do. And you should expect that in your contracts with those initial importers. I hope that helps you. If you have suggestions for other videos, please put it in the comments down below of this video. And don't forget to like and subscribe and share this video with anybody that is importing medical devices or thinking about it. Have a great weekend. Bye-bye.